General fund. It is decreasing, demand is increasing. Our general fund constitutes 15% of our overall Oakland Community Mental Health revenue budget. $42 million. So you can understand between Medicaid and what the general fund is, $42 million is what we're talking about today. The financing of 50% of those 2,100 or 21,000 people come from that pool of money. That pool of money comes to us and we're dependent on the state revenue. So if there's no taxes, no revenue coming in, what the state provides decreases. Then the legislature has to appropriate it. So there's decision making there about what are they going to do with all the revenue, how much is mental health going to get, and compared to all the other needs. Hopefully, the integration and to know that our lives are affected by just more than one service delivery or department is going to be key. But it all works together, and that we're needing to really see what the state is appropriating. And then once it gets appropriated, we have another level where the Michigan Department of Community Health sends it to us through contracts. It has decreased in amounts over the last 5 years. The flexibility that they have given us to manage the general fund has also decreased. We have very limited ways in which we can spend this money. The allocation that the department provides is different among the 46 community mental health service providers, so that the funding formulas that the DCH uses is also an area that we need to be concerned about, because it funds the 46 and also funds the state hospital. Oakland has been the highest funded community mental health service provider since we went into managed care in 1998-99. That ended, though, in fiscal year 10 with the general fund budget reductions. We have experienced in fiscal 10, fiscal 9-10, we experienced the highest general fund reduction in the state. The percentage of the money that we get, Oakland County took the highest percent of reduction. It was at 22%. Detroit Wayne, Macomb County Community Mental Health Agency, and Oakland County Community Health Authority bore 75% of the total statewide general fund reductions. That's $30 million from the Tri-County area of the $40 million statewide reduction in fiscal year 10. We do expect reductions to be coming for several different reasons, but I think the biggest one is that the federal money is being reduced. We're going back up to our state federal match, and so we're needing to use more general fund to maintain the same level of income. And our deficit, the needs have outspent what revenue we come in. We are our county is the fastest growing county for people on Medicaid. It is really demonstrating that Oakland County didn't have that growth of Medicaid population. It's governmental support when times are tough or disabilities, etc. But that is growing as well as our general fund. It's sure from all the job loss for people who've lost their homes, their insurances, etc. We've been given initial DCH planning targets of 20%. While I'm talking about general fund today, 20%, we have two funding streams, so this is not anything that we will be talking a little later relative to Medicaid. Huge complexity, huge risk. It is definitely a focus for all. We spend general fund guidelines, we spend general fund looking at the mental health code and our contract for the guidelines. We do have local responsibility to set the priorities and be able to allocate, the monies within, the general areas. And there are three that I collapsed a couple, but there's three major ones. First is matching funds. We have state hospitals and we have money that's necessary to connect with the state to bring Medicaid in. And those matching funds, that we have zero latitude to impact on. That's about 5 million of the 42. We have community collaborations. When we look at the type of collaborations that we do, Michigan Rehab Services, mental health court initiatives, community corrections, jails, the jail mental health services, behavioral and physical health integration, advocacy, transportation that's essential to our folks' lives in the community, and peer service delivery. Those are all areas of areas that we view are so important, that makes our services really meaningful for the lives of people. And there's also special populations like ACC, Arab American Chaldean Council, and the El Centro. And also newly this year, we're going to be studying how we can be an organization that's much more in tune to the people who are deaf. And that really is an effort that I'm not going to be able to spend Medicaid money on it. It is an area that we have to prioritize, and so general fund is the mechanism of using it. About $2 million in that area goes to the community collaborations. $36 million remains in the direct services, delivery of direct services and supports for between 8,000 to 9,000 people. There is a list, I think, is it over there, the list of the services that we have?
No, we haven't passed it
we
out.
haven't passed it out yet, but there will be a list that will be attached that outlines that. To date, we have not altered. Our commitment to the public was that it didn't matter what you brought to the common ground for assessment and screening, as to what, if you had a Medicaid card or didn't have anything in your back pocket and had mental health needs, we would be able to address those and then be able to do it in similar fashion. We had the abilities to to manage appropriately, but offer that for our citizens, unlike many other counties that could not. This is the year that you don't know how drastically that we're going to have to do that, but there is no way that we will be able, to do that with the reductions that we're going to be talking about. So change really is going to be occurring.